So COVID-19 we think is transmitted primarily through the release of respiratory secretions. That happens when perhaps people cough or sneeze, and that creates droplets which can fly through the air and land on mucous membranes, and they can also fall to land on surfaces, and that's where contact transmission becomes important. We think there is some contribution from aerosols, and the risk for producing those aerosols comes from aerosol generating procedures. So the types of PPE that you need, the standard PPE for suspected and confirmed cases is a surgical face mask, gloves and aprons. That surgical face mask prevents droplet spread. And in the setting of aerosol generating procedures, you need the respirator face mask together with gloves and the gown. So the national guidance is on the government pages, gov.uk, the coronavirus pages. There's also information on the Trust intranet, and if you wanted some specific advice, that would be contacting the infection control team.
We are now going to talk you through how to don or put on Droplet Precaution PPE. As a reminder, you will use this when seeing any suspected COVID patients as well as confirmed cases of COVID in your day-to-day care of them. Before you begin, make sure you have removed any jewellery. Also, make sure you have your hair tied up. Once you have done this, make sure you have everything together that you will need to use. This should include an apron, a surgical mask, one set of gloves, and alcohol gel. To apply the PPE, first of all, begin by gelling your hands as per WHO guidelines. Next, put on the apron. The apron should be applied before your face mask to ensure that the mask does not move while you put the apron on over your head. Once the apron is on, move on to applying your surgical mask, ensuring this covers your mouth and nose. If you are doing a splash-prone procedure, you may also wish to wear eye protection, which will come in the form of a visor, and a gown. However, this is not required in your day-to-day care of patients. Once your mask is applied, you can apply your gloves. You are now ready to enter the patient area. Once you have seen your patient and are ready to leave the room, you will want to ensure you doff or remove your PPE in a safe manner. This is very important. While you are still in the patient room or area, begin by removing your gloves and put them into the infectious waste bin. You remove your gloves first, as these are the most contaminated part of the PPE. Once you have removed your gloves, gel your hands as per WHO guidelines. Next, remove the apron. Begin by breaking the tie at the back. This is the least contaminated area. Pull the apron away from the neck and shoulders, touching the inside only. Fold and roll into a bundle. Discard into a waste bin. Now gel your hands using the WHO hand hygiene technique. You are now ready to leave the room. Always ensure you do not touch your mucous membranes at any time. Now you have exited the room, you can now remove your mask. The front of the mask is contaminated. Do not at any time touch the front of the mask. Begin by unfastening the ties. First the bottom, and then the top. Pull the mask away from the face without touching the front of the mask or respirator. Discard it into an infectious waste bin. Now gel your hands again or wash with soap and water. Well done.